Hello, my name is Christine Bowen, and this is a video presentation on human and animal participants for Aspen University. The first topic I want to talk about is institutional approval of research on human subjects. The first point I'd like to bring up is the protection in the interest of the research subjects, and the reason is it brings many benefits. One of them being the risks to human participants are minimized. The risks are reasonable given the expected benefits, and to provide informed consent and confidentiality of data and patients are maintained. The protecting of the interests of research subjects is complied by federal, state, and local regulations and with relevant codes established by professional groups. Animal participants, most of the documentation that has already been published states that there are 3 R's: reduction in the number of animals used, refinement of techniques, and to reduce pain and distress for each animal. The next point is about pilot studies. And what a pilot study is it's a small-scale study that determines what the best large-scale study would be. The researchers can identify and refine the research questions based on doing this pilot study. And then it can determine what the best method of study to use for that large-scale method. It can also help estimate the time and resources needed for that final large-scale study. Common methods for data collection with human participants. There's a few of them, one of them being questionnaire, surveys, and patient-reported data, proxy or informant data, review of ambulatory or hospital medical records, collection of biologic material. The sample selection and consent is the next point that I'm going to discuss, and choosing the sample size is the majority of it. A few of those different options would be the sample size is chosen based on the study design, the outcome expected, and continuous response variables. So for example, when determined by the study design, descriptive studies need hundreds of subjects to give an acceptable confident interval for small effects, and experimental studies generally need a lesser sample. The outcome expected under study should be considered, and then larger sample size is required to assess the categorical variable compared to continuous outcome variables. It can also depend on an acceptable level of significance, power of the study, expected effect size, underlying event rate in the population, and standard deviation in the population. Some more factors that could be considered while calculating the final sample size include the expected dropout rate, an unequal allocation ratio, and the objective and design of the study. And finally, for that point, is gaining consent importance. Participants should fully understand the risks and the benefits before giving their informed consent, and then also participating in the study. And then the importance for the researcher would be that they're not liable if there were something to go wrong. And then my last point that I'd like to discuss is research protocols and instrumentation. So research instruments that can commonly be used for both human and animal studies is interviews, tests, surveys, and checklists. Typically, research instruments are done after conceptualization, but before operationalizing. The research instrument they choose is usually determined by the researcher, and it's tied to the study's methodology. The different type of interviews that can be done are structured interviews, unstructured, non-directive, focus, and focus group interviews. The different observations are structured, naturalistic, and participant. And the different surveys are survey research, free answer, guided response type. And hopefully that is a good summarization on what's expected with human and animal research. Thank you.